Hello, my name is Sonia, and this is my presentation on nephrology social work. Okay, so the population differences. The difference with this population is that it involves those who have kidney disease. According to Giller and Brown from our textbook, end-stage renal disease is stage 5 kidney disease that requires lifelong treatment via hemodialysis, peritoneal dialysis, or a kidney transplant. It primarily affects the minority population such as African Americans, Hispanics, and American Indians, and patients are typically 65 and older. This disease affects patients on a psychosocial level as well. When it comes to disease-related, ESRD, which is end-stage renal disease, commonly occurs along hypertension and diabetes, which affects their everyday life even more. So here you can see the different stages of kidney disease. The two main needs with this condition are a healthy diet and dialysis. There are two types of dialysis. As stated before, it's hemodialysis and peritoneal. Hemodialysis is used to remove waste and extra chemicals from your blood via an artificial kidney or hemodialyzer, which is this picture right here. It makes entrance into your body or your blood vessels through minor surgery. And then peritoneal dialysis cleans your blood within your body instead of outside by placing a catheter into your abdomen through surgery as well. According to Gilhert and Brown, dialysis patients must stick to a strict diet due to their inability to process high levels of potassium and phosphorus, in addition to needing a restrict sodium intake. Too high of potassium can lead to heart failure, and high phosphorus levels can lead to permanent bone disease and calcification of the heart. The food in which they are limited for are bananas, melons, dried fruit, tomatoes, oranges, potatoes, and nuts, among a few other things. In addition to food restrictions, they also have fluid intake restrictions because excess fluid intake may cause their extremities to swell and their lungs to fill with fluid. Peritoneal, so that was just for hemodialysis patients. Peritoneal dialysis patients have a much less restricted diet and fluid intake, and those who have undergone a kidney transplant do not have any restrictions to their diet. Those are the three treatment options for somebody with kidney disease. As a social worker, one way to address the needs of this group is to educate themselves in general of dietary needs to help patients and families cope with the changes. Additionally, it may be beneficial for social workers to be trained to help patients and family by providing support in all areas in general, such as emotionally, financially, and just the lifestyle adjustment in general. Some social work needs. Social workers need an abundance of community knowledge to help patients. These could include having access to make referrals when needed, understanding the different agencies or federal programs available and what they offer, understanding health insurance, being able to assess individual needs, and the ability to offer various transportation options. This kind of coincides with what the patient may need, which are access to rehabilitation, rehabilitation centers, educational programs as it is a new learning curve, and access to support groups. Some skills that a social worker may need aside from case management for this scope in general. They should have skills such as counseling, education, and crisis intervention. Counseling may be beneficial as dialysis patients may develop depression to some degree, and being able to provide support specific to their condition may ease the burden. Crisis intervention goes hand in hand with counseling as it is providing support to those who are in acute mental health crisis, whether it be due to recent trauma or something such as PTSD. And then education surrounding the specific group may aid in more support in having skills in crisis intervention is